We need to raise the issue of stigma because it's one of the top things we can do as health professionals to make people feel welcome and to bring them into a space and help them meet their goals. A couple of times when I've been working with someone who was pregnant and had a substance use issue, and they come in for their appointment with the midwife and we chat to them about their pregnancy, they might say, "Oh my gosh, you're the first person that has congratulated me on being pregnant." And that's kind of heartbreaking. People with really complicated lives can and do have babies, and they're often just as excited as anybody else to be pregnant and to be welcoming a new life into the world.
I had a woman who went to her GP clinic. Her normal GP was on leave, so she went to see somebody else. She was 7 months pregnant at the time. The GP decided that she didn't need her medication, her buprenorphine, because it would be bad for the baby, it would be bad for her, so she decided just to not just prescribe it. It got to the point that the mother and the baby's life became at risk. Luckily, the pharmacist actually contacted PAMS, who then contacted me, and I was able to sort her a script out very quickly in order to provide them much needed medical care. But it's a situation that shouldn't have happened.
People who use drugs or alcohol during pregnancy typically care a great deal about their baby and about their pregnancy, and in fact it can be a time when they're able to do the most. It can be a time when they're able to make changes for somebody else, which is their baby, that they have never been able to make for themselves.
To me, there's no other healthcare sector where someone will come in and say, "I have this issue," and by supporting them correctly with that issue, they can get their kids back, they get their finances back in order, they can find housing, they're no longer homeless, they actually get healthy, they can get a job for the first time. You know, they can get their driver's license back. I had one person was excited that they were actually able to go on holiday to Queensland because they could go without a dose and they could finally see their kid after 2 years.
One of our mums talked to us several years later and said, "You know, when I first came in to talk with you guys, I'd been using a lot of drugs, I was really scared, and I was planning to just leave, but someone came and just said, 'It's cold outside, can I get you a coffee and help you warm up?' And that changed everything for her. She felt really welcome, and she came back for all of her care, and she's gone on to really enjoy being a mum.